Good morning, everybody. Thank you so much for joining us here this morning for the annual Vienna NGO Committee Informal Civil Society Dialogue with the World Health Organization. I'm really happy to welcome you here today with some of our colleagues from the World Health Organization. I'll just quickly introduce everybody. We do have quite a lot of questions to get through, so we will try and move quickly and then allow our colleagues to get to the scheduling at 10 a.m. So we're going to aim to finish about 5 minutes early if that's possible. So I would just, maybe I'll hand over to colleagues to introduce themselves, but I might start with introducing Mr. Deus Mubangivi, the Director of Health Products Policies and Standards at the WHO.
Thank you so much.
Thank you. We also have our colleague Dilkushi Puvendran, the Technical Officer for the Expert Committee on Drug Dependence. Thank you for joining us, Dilkushi. We also have Anya Busa, who's the unit head of the Alcohol, Drugs and Addictive Behaviors Unit of the Department of Mental Health. I think I got that right. Thank you for joining us, Anya. And unfortunately, our colleague Annette Verster from the Department of STIs, HIV and Hepatitis is unable to join us this morning, but Anya is able to answer some of the questions, and I understand that Annette is able to answer in writing some of the questions that might not be able to be answered in full today. So we will get started. The first question we have today is from Instituto RIA in Mexico. I can't see Zara here, but would another colleague, Marie, be able to ask the question, please?
Thanks, and good morning. Can you please speak a bit to the current process of the WHO in undertaking the COCALIF review, including the possible timeline?
Thank you so much for the question, and delegates, glad to meet you. To the question on the process, this process on review of COCALIF was initiated at the request of a member state that, under the conventions that requested that we review the current scheduling of COCALIF, where it appears in Schedule 1. And based on that, we committed this question. This request came at the end of 2023, and through the UN Secretary General, and was transmitted to the Director General of WHO. The WHO Director General committed to review COCALIF within 2 years, and the first was to then request any information that would be supportive or that would provide information to support the evaluation and decision making. And this request was made last year as part of the process of the 47th Expert Committee on Drug Dependence, even though the critical review was not scheduled for the 47th Expert Committee on Drug Dependence. A call was made for submission of information, and on the first day of the Expert Committee on Drug Dependence that sat in October, an open session was held where parties were given a chance to submit any information, both orally and in writing. And indeed, out of the 14 interventions we had, 13 of them were on COCALIF. Submissions were accepted until the 9th of December, and a lot of submissions were received. We also put out a request for submission of information in terms of experts that would be involved in evaluation of the information that we receive. And this was a global call, and we received a number of experts, of course, that were assessed based on their expertise, but also to make sure that conflict of interest is not involved. And the experts have been selected and commissioned to conduct the review. We, as part of the preparation of the 48th Expert Committee on Drug Dependence, The agenda for the meeting will come out around May, but will surely include the review of coca leaf. And following the publication of the agenda, we will send a questionnaire in July, to all member states again to submit information on all items on the agenda, including coca leaf. The critical review report of all items on the agenda for the 48th Expert Committee of Drug Dependence, including coca leaf, will be published 30 days before the expert committee in October. That means at the beginning of September, and will be published on the website, and where again parties would have an opportunity to look at the critical review report and may have any interventions or comments to give during those 30 days, including on the first day of the week of the expert committee review, where a public consultation will be again held, and people will have an opportunity to intervene. Following that, then the committee will go into a closed session to decide upon and make recommendations of all items, including coca leaf. The recommendations of the expert committee will be then transmitted by the Director General of WHO to the UN Secretary General, who will in turn transmit it to the CND at the beginning of December, and the members of the convention will have an opportunity to vote on the recommendations in March 2026. So a long intervention, but hope it gives you the process and the timelines for the review of coca leaf. Thank you.
Thank you very much. That was a fantastic answer. I've got another question for you, Deos, and this one is from the International Drug Policy Consortium. Marie again.
Sorry, it's me again. The WHO, as an agency of the United Nations, is bound by the core objective of promoting and protecting human rights. Could you explain how human rights, in particular the rights of indigenous peoples, will be taken into account during the ECDD's critical review of the coca leaf? Thank you.
Indeed, universal access to health and the right to health is something that is promoted and supported by WHO. And indeed, that's why we actually ensure that access to quality assured health products is a right to all, both in affordability but also accessibility. Of course, we equally, in the promotion and protection of health, we equally ensure that the public is protected from any harm. So the first concept of protection of right is scientific assessment of any products that are used for any health purposes that indeed they promote health, but also if there's any harm, we recommend measures that do protect health. In the process of review of coca leaf, we know that a number of societies do have used coca leaf for a long time for traditional purposes and all. And as a result, we have interacted with our traditional medicine unit in WHO to make sure that the expertise in this area is engaged during the process of evaluation. We also have a colleague working on human rights within WHO, and those who were at the open consultations last October, so that both our traditional medicine colleagues and our colleague who works on human rights were with us on table to make sure that they are fully involved. So the two aspects of both traditional use and human rights will be engaged through during the process to make sure that these are considered. But at the end of the day, we want to make sure that people have access to the quality assured health products, but also are protected from harm. And indeed, all these aspects will be considered. Thank you.
Thank you very much. I do have one more for you in this block of questions, I think. Our next question is from the European NGO Coalition for Just and Effective Drug Policies.
Hello, good morning, everyone. So the question is simple. What are the lessons learned from the previous WHO scientific review of cannabis that could apply to the ongoing COCALIF review to avoid delays in the implementation?
Well, starting with the last bit of delays, I think for those who were in the session yesterday, I did highlight the challenges of reviewing plant-based products. Because unlike synthetic chemicals and products that have a pure chemical and you are dealing with one substance and you can assess, plant-based products have several, and sometimes we talk about hundreds of chemicals within, and you must be able to assess either the attributes, whether they are related to one of them or the totality or a selection of those. And therefore, that's why right from the start, when the request was received, the Director General upfront notified the parties that we will need 2 years to be able to do that and do it properly. So the timeline is very clear. But I think to the point, we will stick to those timelines. That's the first point. The second point is to make sure that the process is as transparent and independent as possible. So that's why at several, including last year's, at the reconvened 67th in December, and now we are updating everybody on the process and the timelines. Thirdly is the criteria. We have been transparent about the criteria that is used in the evaluation, and this has been actually published and also will continue, and will be very clear also on the questionnaire. In terms of engagements like this, is to make sure that we are transparent also to everybody about the process, to make sure that everybody has an opportunity to have an input. And lastly, based on the independence of the assessment and scientific evidence, and that's why we call upon everybody who has information to do submit it, because often lack of information or inadequate information leads to not so strong recommendations, and therefore it can result on disappointments because of the, but given the process that we have taken to receive information, we are confident that we and the studies we have commissioned, we are confident that we will have adequate information to make a recommendation that is evidence-based and backed by science. Thank you so much.
Thank you very much. The next question is directed towards Anya. Do we have our colleagues from the Youth Anti-Narcotics Public Union in the room? It's about Mamadov. I might ask this question. So what initiatives and resources does the WHO offer to NGOs seeking to implement modern methods of prevention and treatment of drug addiction? Thanks.
Thank you so much for the question, and also first of all, greetings and good morning. And it's my first NGO hearing in this role, so very exciting. And with regards to the question, I mean, as you know, obviously, WHO together with UNODC has published both the international standards on drug use prevention, right, and the international standards for treatment of drug use disorders, right? So those are a good base kind of for this work, and also a resource, of course, for civil society organizations, same as member states. And in those, we have kind of made a review of the evidence available at the time when they were published. And I think, you know, evidence and standards like this, of course, need a constant or at least a regular update of the evidence, and especially with a view to the international international standards on prevention of drug use that were published, I think, in 2018. It would be great, and we would be very happy to also update them at some point. Obviously, this is always a question to extra budgetary resources. The other thing maybe to share, which would be relevant to this question, is that we are currently developing an implementation toolkit for the international standards for the treatment of drug use disorders. And in that implementation, of course, there will be a clear role for also civil society organizations as those get rolled out. Maybe, and we've mentioned those in some of the side events also, you have seen that there recently were published the MHGAP guidelines for mental, neurological, and substance use disorders. And those also provide updated guidance, for example, on psychostimulants, which we have presented here also yesterday at the side event on psychostimulants. And there is additional new guidance, for example, on digital interventions and the areas of recovery management. So I think also having a look at these new MHGAP guidelines would be interesting, especially with a view to update it. And just to say, my response to this question is tiny little bit longer, but then I can keep others maybe shorter because it gives a bit of an overview. I think, and this also points to some of the maybe questions of interest, is that good to know that we're also updating, and that's ongoing, our 2009 guidelines on psychosocially assisted pharmacological treatment of opioid use disorders, together with the 2014 guidelines on community management of opioid overdose. So watch out, right? So updated guidelines also in this field are coming. And then, and here I can stop the list also at some point, but I think equally relevant kind of for civil society working in this field of prevention and treatment will be the tools that we have available on screening, brief intervention, especially the ASSIST, and just reminding that the ASSIST tool also goes together with the self-help guide. Furthermore, WHO now has the WHO Academy, which puts also quite a number of resources online. And for example, the MHGAP package, which is for mental health, substance use disorders in non-specialized healthcare settings. There is an online course available, and the substance use module of MHGAP is also part of this. Maybe as one last example, also to point to you to the SOS project and initiative we had on emergency management of opioid overdose. So for that, we demonstrated on one side, and civil society organizations were much involved, the feasibility of take-home naloxone schemes also in low-middle income countries, but also maybe of relevance is that the training materials that we used in this initiative and that helped very much to the success of this initiative, we have reviewed, finalized, and again, a little bit depending as to our budgetary resources, they will now be going through a design process and editing, and then should be available. And it's kind of a 3-level training material really to train in the end people likely to witness overdose in effective management in line with guidelines and then hopefully the updated guidelines. Thank you so much, Penny.
Thank you, Anya. We have a couple of further questions around community management of opioid overdose. Do I have Kitty in the room from Open Society Foundation?
Oh, yes,
Judy.
I'm asking you. Hi, good morning. So this is a related question, and you mentioned civil society involvement in the development of guidelines. But I just wanted to understand more on how community and civil society representatives will be involved in the consultations, particularly around the WHO guidelines for the treatment of opioid dependence and community management of opioid overdose. Thank you.
Yes, sorry, I had put it off because of the echo. There we go. Thank you for the question. And it'll go back a bit in the process, right? So civil society was invited to participate in an informal public consultation that already took place in December 2024 around the update of these guidelines. The public consultation was very much kind of for the scoping of the guidelines, right? Also to see what kind of research questions would be relevant to pose for the guidelines and the systematic reviews to follow. following this December 2024 public consultation, there was also an open survey that was shared for comments, published at the WHO website. We shared it through our networks and we encouraged further dissemination. So from that, we also collected feedback and used it for the scoping and shaping the research questions. Then furthermore, that was slightly more recent, we circulated an open call for the relevant systematic literature reviews, and research teams from including civil society, academia, and others were encouraged to apply for these systematic reviews. And then in the guidelines development group, there is a civil society representative and representative for persons with lived experience. The full composition of this guidelines development group has been published on the WHO website in February 2025. The first meeting of the Guidelines Development Group will now take place in November 2025, and that group will consider the evidence and make recommendations on the topic of the guidelines, right? So pharmacological treatment and overdose management. And then after the recommendations have been made by the Guidelines Development Group, a draft document will again be circulated for peer review, including, of course, by civil society. So watch out for that, right? And just on the overall process, we expect that the guidelines will be available in 2026, likely more towards the end of 2026. And we hope very much then also for civil society organizations to be partners in the implementation. I mean, one of the things which maybe in any case will be of interest, right, just to say that also recently we hosted a webinar to address the current kind of shortages of opioid agonist treatment that have been observed in many regions of the world, and presented as a background document to the webinar some guidance on mitigation strategies and so on, which is currently being circulated also. Thank you.
Thank you. We have another question on this very similar topic. I think it's coming to us online. Is Ruby here from Youth Rise?
Yes. Hello.
Thanks.
Hi.
We got
So you can hear me, right?
Yes, thank you.
Perfect. So how can the World Health Organization and other UN agencies work together to ensure that member states, in coordination with civil society organizations, develop and implement national guidelines for community-based naloxone distribution and overdose management in line with the World Health Organization's 2014 recommendations? Additionally, what mechanisms can be established to track and report on progress, ensuring that all member states prioritize overdose prevention as a public health issue rather than a criminal justice issue? Thank you.
Yes, thank you so much for a question on, let's say, same area, maybe a little bit. So, I mean, as you know, right, so WHO and partner agencies, we support in general countries in their own efforts to develop effective strategies to address, including opioid overdose and opioid use disorders. And I think, I mean, one thing which is good to take into account, and maybe also as CSOs, then you can remind the member states that the member states themselves declared the response to opioid overdose as a high priority. And in that sense, I mean, it's found in the UNGAS 2016 outcome document. I always find it pretty impressive that naloxone is the only medication mentioned in this high-level document. And I think on that base, it's good to have continued advocacy and, of course, also national level dialogues and joint work to keep this on the agenda. So, I mean, one of the things which I said already, the 2014 guidelines on community management of opioid overdose have been widely shared and are currently being implemented. And we have also implemented them, let's say, very much directly and evaluated them to some extent in the framework of this SOS project that I mentioned on opioid overdose management. And I think the guidelines, which WHO does and which have a global remit, of course, can be a framework or can be used as guidance also for the development of nationally relevant guidelines and overdose response strategies, right? And I mean, in addition, maybe, and that goes maybe more to the second part of your question with regard to monitoring. So WHO has a Healthy Cities initiative, and that has included a number of indicators at the municipality level. And there are indicators around opioid overdose. And with the monitoring of this initiative, there will also then be a view to outcomes, for example, regarding overdose. I mean, and in general, when it comes to the work at national level and supporting countries and then different stakeholders, including CSO at national level, in their really national or subnational efforts to develop national guidelines, we would be very happy to do that, but it's really a resource question for WHO or regional and country offices, how much that can be done. But let's say our global guidance is available for that. Hope that responds the question, or was there a part in the question? Yeah, well, I think there was also the part of the question how, so to say, this goes, that it's really considered as a health issue and not as a criminal justice issue. And maybe here to say, I mean, that so we have partnered for many years, including with agencies such as UNODC, on these relevant areas, right? On overdose management, the development of the international standards on drug use disorders, but also on the topic of treatment of drug use disorders for people in contact with the criminal justice system and alternatives to conviction or punishment. And the message from WHO, I think it's clear, and I think it's also in line with multiple internationally agreed resolutions and declarations, as well as scientific evidence. Drug use disorders are first and foremost health issues, and therefore the response needs to be in health and social services, and people who experience overdose obviously should receive the help and support they need and should not be afraid, for example, to call ambulances due to any criminal justice repercussions. And maybe anecdotally, just to say that when we did this SOS project and initiative, we also did a qualitative evaluation with interviews and focus groups. And one of the things that came up there a lot is that it was helpful to train first responders, which in some cases also included police together with people likely to witness an overdose and people using drugs. And many, at least in the qualitative evaluation, said how that reduced stigma. And there was this mutual let's say, perception, right, that everybody is working together to save lives in the community. But in that sense, if you want to read this up, I mean, this is all published both in the SOS report on our website and in scientific articles behind it. Thank you so much.
Thank you very much, Anya. We have another question for you next on the list from the Dhaka Asylum Mission and the Uganda Youth Development Link. Do we have Iqbal or Rogers? No.
Hey, my name is George from Slumchal. I'll read on behalf of Rogers Kasire, Uganda Youth Development Link. And this is the question: how can World Health Organization's drug prevention activity be strengthened at the regional level?
Good, thank you. Thank you so much for the question. And I mean, I said a few words before around the international standards for prevention of drug use, right? So there are there. And I also pointed already kind of that it would be good to update them. And I'm sure it's also always very good kind of to have, for example, implementation toolkits or a discussion on how these globally relevant standards can be implemented and to maybe to some extent adapted or prioritized with a view to regional kind of specificities or even at the national level, right? And then maybe just to say kind of in terms of the organization of WHO, you know, we have the global headquarters, right? And then we have regional offices in all of the regions of the world, and they play a very important role in strengthening health actions at the regional level, including then in this case on prevention of drug use. And maybe just to point as one example, the WHO office in the EMRO region, so that's the Eastern Mediterranean, let's say going from North Africa all the way to Pakistan, Afghanistan. That region now has launched as a flagship initiative, on substance use, which is quite special, and we're very happy to see that. And that the flagship initiative aims to generate interest and funding also to support public health action and relevant aspects of addressing substance use, you know, in all of this continuum of care, from prevention, treatment, care, harm reduction in the region. And that had emerged also as a priority there from the countries. And in the initial meetings and policy dialogue, civil society was an important partner. And of course, advocacy for prevention in other areas to bring substance use higher on the agenda at the regional and international level would be equally relevant. And yeah, I think I leave it like that also for sake of time.
Thank you very much, Anya. The next 3 or so questions I understand to be better directed towards the Department of STIs, HIV and Hepatitis. As I mentioned earlier this morning, unfortunately, Annette could not join us this morning, but Anya is going to be able to answer some of these questions in brief, and some of the responses will be elaborated in writing to the people that have asked these questions. But the next question I have is from the Eurasian Harm Reduction Association. I believe I'm handing over to Linus. Thank you.
In response to humanitarian crisis caused by armed conflicts, harm reduction NGOs have become shelters for people who use drugs and their families, ensuring access to comprehensive health care. Given this critical contribution, and as WHO coordinates global efforts in pandemic preparedness, how can WHO ensure that governments meaningfully include community-led responses in pandemic preparedness and emergency risk mitigation planning?
Yeah, in general, of course, we cannot ensure really what governments are doing, right? We can advise, we can support, we can provide technical assistance, but maybe 2 things with regard to your question, and it will be really good if Annette also adds on to this. I mean, one thing which I have mentioned before, more generally, let's say in terms of crisis response, and one of the things we are seeing at the moment, but that's also something we had seen before in humanitarian crisis, was kind of shortages, including of life-saving medications such as opioid agonist treatment. And with a view to current situations, as I mentioned, I think in response to an earlier question, we had just kind of hosted a big webinar, kind of invited many civil society organizations and other stakeholders from different parts of the world to provide some guidance on mitigation strategies in situations of shortages of pharmacological treatment of opioid use disorders, for example. The other thing maybe to mention to you, what we are doing in terms of humanitarian assistance, and that I say more in with my Anya hat and less kind of also with the Annette hat, let's say, is that WHO in the framework of the Interagency Standing Platform, which is the oldest coordination committee on humanitarian assistance, is co-chairing a group on substance use, which is under the group on MHPSS in that platform. And we have currently developed, together with the other co-chairs, UNHCR and UNODC, and many civil society organizations that are part kind of the Interagency Standing Committee groups, some training materials on addressing substance use in humanitarian settings. And they have currently been field tested in different parts of the world, including by some of the civil society humanitarian actors working in humanitarian emergencies. So they are in principle available for this purpose, but will also be published by the Interagency Standing Committee at some point. Thank you.
Thank you very much. The next question is from the Turkish Green Crescent Society. Do we have Sarah in? Oh, Representative, thank you.
Good morning. On behalf of Turkish Green Crescents, I am presenting this question. My name is Musa Dawood from the Jordan Anti-Drug Society. And the question is, how does the World Health Organization deal with the issue to ensure that countries keep balance between harm reduction approaches and prevention instrument and have effective treatment options available, particularly for vulnerable populations? Thank you.
Yeah, thank you so much. I mean, the first part of my question, just in general again, right? So as UN organizations, as we are supporting countries in their work, so we can help in reviewing and updating scientific evidence. We can provide recommendations, technical assistance. We can engage and train policymakers or facilitate policy dialogues, including at national levels, right? But we cannot really tell countries what to do. In that sense, but in terms of kind of this continuum and the different interventions, so I think it's clear also from our technical publications that interventions are not an either or between prevention or harm reduction, treatment or prevention, or treatment or harm reduction, right? And we are also here representing 3 departments in WHO, right, that are all working on these important areas. So, I mean, I think what we want in reality, like for any other health disorder, is a continuum of care, right, where different people at different times and in different settings receive the services they need, right? So that might be primary prevention for people that have not initiated substance use but might be vulnerable. That might be treatment of substance use on a voluntary basis, evidence-based, right, for those living with substance use disorders. And at the same time, we need unconditional harm reduction interventions and that are beneficial and life-saving for people using drugs, right? So and in that sense, harm reduction is part of the overall health system response. It's not an isolated strategy, same as the others, right? It all belongs together in an effective continuum of care. What we are hoping to produce, but in these things I'm always pointing to our extra budgetary resources, is really a technical package that brings all of these interventions also together and takes into account experiences from different areas and different perspectives. I mean, maybe to say that sometimes in this regard, when we work with countries, we also would work through an opportunity lens, right? So if we are invited to work more on prevention, let's say of substance use, then that would be the entry door, but we would have the continuum of care in perspective. Similar, if we are invited, so to say, to work on harm reduction measures, then that would be an opportunity to engage and then, so to say, broaden and talk about the wider spectrum. So thank you so much.
Thank you very much. I might just mention I'll do a bit of a time check because we are trying to finish the session a couple of minutes early. We've still got about 8 questions to go and about 20 minutes. So the next question is from Harm Reduction International. Thanks, Marcel.
Hello, good morning. It's a little bit long question, but I want to give some context. In November 2024, the Global State of Harm Reduction by Harm Reduction International reported that 93 countries provided needle syringe program NSP and 94 countries with opioid agonist therapy OAT programs. Across low and middle income countries, there is an estimated of 94% funding gap for harm reduction, with just $131 million provided by governments and international donors in 2022. 5 months later, that picture is very different, and the sustainability of harm reduction intervention is more uncertain than ever. What action is WHO taking to mitigate the fallout of the US funding freeze on access to HIV prevention for people who use drugs, in particular OAT, and to guarantee access to essential harm reduction services in the long term? Thank you very much.
So that question, our colleague Annette will also respond to you, but I just say a few words, right? So that one thing, of course, that we're equally concerned, right? And maybe to say, again, with my Anya hat, that also in the framework of the Global Status Report on Alcohol Health and Substance Use Service Capacity, we're also monitoring kind of the capacity of different countries in providing interventions. And we're also asking, for example, of the capacity to deliver, for example, as you mentioned, needle syringe services and so on. And then if you look at the Global Status Report, there you can see there is a service capacity index for each of the countries, and we report kind of this capacity kind of across the globe also in that report, just as another kind of point of information. And then with a view to the current crisis, I mean, on one side, of course, there are organizational-wide strategies, right, to mitigate funding shortages for a lot of our programming, including the programming around harm reduction. But again, just to point to you that the most concrete and short-term thing that we could have done was this webinar that I have mentioned and the background document that was prepared really in a very short time and with a lot of support from colleagues around mitigation measures, right? So what can be done if there are sudden interruptions, including of opioid agonist treatment, which of course should not be, right? But which, if it's a reality, we provided at least some guidance what to do in these kind of emergency situations. Thank you.
Thank you. We have another one for your Anya hat, I think. This next question is from the Association Proyecto Hombre. I've got Elena.
Good morning. This is my question. To what extent is the World Health Organization advocating at CND on the need to prioritize the prevention of the most prevalent substances in society, such as alcohol, tobacco, cannabis, or non-medical use of prescription drugs, while addressing the social determinants that are influencing their use? Thank you.
Thank you so much also for the question. And you're all coming to CND already for many years. In principle, there is a little bit, let's say, a division of work, right? So that internationally controlled substances are more discussed here, whereas of course as WHO, we have a mandate kind of around all psychoactive substances, including alcohol and so on, and even going further also on addictive behaviors, right? So, and here at CND, I mean, we have presented in numerous occasions, just also now mentioned status report on alcohol, right, health and service capacity. And in that sense, also always presented the different prevalences, right? How alcohol, tobacco, or drug use kind of relate to each other, of course, with alcohol being the most widely used psychoactive substance, right? And I mean, also that for alcohol, the member states, and that's now in Geneva at the World Health Assembly, have adopted a global strategy. And there is also an alcohol action plan available, which kind of my unit is working on. And to operationalize further the alcohol action plan, there is a so-called SAFER initiative, which has the 5 best buys on what we know kind of that works kind of with regard to alcohol prevention and so on. And what we know is that population level interventions are really the most effective in this area. Then just to say, I mean, there is also the Tobacco Control Framework Convention, right? That was passed and that at least to some good extent was instrumental in the decrease of tobacco use globally, right? Maybe also just to say that then there are the teams of WHO not only on social determinants of health, but we also have a team on commercial determinants of health. And I think it's also very interesting to look into their work as they are sharpening our understanding how private sector influences our health, kind of including with the view, obviously, to alcohol use or tobacco use, right? And in terms of internationally controlled substances, the one with the highest prevalence, as you of course also all know, would be cannabis. And we're currently updating our guidance on the health and social effects of non-medical cannabis use. So that's a little bit of work still ahead, but that should also be coming soon. So, and maybe just a shout out to everybody in this regard. At the end of the Global Status Report on Alcohol Health and Service Capacity, I mean, we are also asking for kind of really more advocacy around substance use and keeping it on the agendas. And in that sense, also a shout out to all of you and the good work you are doing in this regard. And, you know, and with your questions, you already kind of gave me a chance, so to say, to also speak about alcohol and other psychoactive substances. So thank you so much.
Thank you. The next two questions, I understand, will be answered by Dilkushi and Anya as well. I'll hand over to Steve Rolls from Transform.
Hello, thank you. Cannabis regulation models for non-medical adult use are now being implemented on every continent. Whilst the WHO provides high-impact best practice guidance on regulatory policy for alcohol and tobacco, just mentioned in the previous answer, they have yet to provide any to the more than 45 cannabis reform jurisdictions that are home to more than 500 million people. As this reform trend appears set to continue, when might we see some best practice guidance similar to, for example, the Framework Convention on Tobacco Control, on cannabis regulation from the WHO, so urgently needed at this critical moment in the emergence of a new industry? Thank you.
So you hear my voice a lot. I'm sorry. Thank you so much for the question. And I mean, one of the things I also just pick up from the previous response. So just to say that we are updating the 2016 guidance on health and social effects of non-medical cannabis use, right? And this will have an update of the evidence, which also includes evidence from jurisdictions that have changed cannabis laws in different ways in the last years. But maybe just to say that this upcoming publication will not be normative in nature. So we will provide an evidence update, but it will not have recommendations. So for a full systematic evidence reviews, which we would need, right, in order to do what you have asked, to produce public health guidance on non-medical cannabis in use in jurisdictions with regulated markets, that mainly would mean we really have to do a number of high-level systematic reviews. And for that, we would need substantial resources, which we do not count on at the moment, right? So, I mean, that's really a barrier, right? And one of the things that we found at least interesting, but I need to be clear, it's not obviously not a WHO publication, but there was a 2024 report from the National Academy of Science in the US, which you have likely seen, right? So that it has pointed us to a lot of issues also with regard to methodological difficulties, the heterogeneity of the studies that are available in terms of the evidence, obviously the well-known heterogeneity of the policy landscapes that are emerging. And so in that sense, while these systematic reviews could be done, but we also would need to think really well in the light of that if we enter that process, if we would, so to say, find sufficient conclusive evidence to really make recommendations, or if the time is maybe still too early, right? But in the end, it's massively a resource question, kind of, if we could do these systematic reviews or not. And then maybe to say, or what we can learn eventually from the other strategies, and including the strategies around alcohol. So I pointed before to our Safer initiative, and I just picked up, so to say, so the 5 best buys from the Safer initiative around alcohol regulations. And so, and the guidance from Safer is that on one side, we need to strengthen restrictions, in this case on alcohol availability, right? And then Safer recommends to advance and enforce drink driving countermeasures, that we need to facilitate access to screening, brief intervention and treatment, and that there should be bans and restrictions on alcohol advertising, sponsorship and promotion, right? And that prices for alcohol need to be raised through excise taxes and pricing policies. So that's the guidance more or less around alcohol, but for cannabis and in jurisdictions that have legalized, we really would need to do very careful evidence reviews before we could do any recommendations. Thank you.
Yes, and I can add to the question on behalf of the Division of Access to Medicines and Health Products. So since 2019, WHO has been revising a 2012 document on ensuring balanced national policies on access to controlled medicines. So in 2019, we had a public consultation to determine the scope of the guideline. And during that public consultation, it was recognized by many stakeholder groups that the original scope of the guideline from 2012, which focused on access to opioids for mostly pain management, palliative care, and opiate agonist treatment, should be expanded to consider all of the different types of substances that are used and being explored for medical and scientific purposes for many different clinical indications in the current context. Therefore, we have been kind of progressing with this evidence-based guideline again, which is underpinned by a systematic review, which will kind of cover all classes of psychoactive substances, including, and it will cover kind of the use of cannabis for neurological disorders and so on. And this guideline will be launched in May of this year in the sidelines of the World Health Assembly, and it will really serve as a document to help policymakers ensure balance, to ensure that medical substances are available for medical and scientific purposes where needed, and also by protecting from the harms that could arise from those substances. So this will be kind of a starting point, I think, for future discussions and future work on how to really achieve that balance of ensuring that these substances are available while protecting also from the harms associated with their use. And again, it will be underpinned by scientific evidence. So this will be launched, as I said, in May of this year.
Thank you. I'm just going to note the time again because some of our colleagues do need to leave in a couple of minutes. So unfortunately, if we don't get through all the questions, we will ask our colleagues to respond in writing. The next question is from the Karim Khan Afridi Welfare Foundation, Christine.
Thank you. My question is, what are the strategies being developed by WHO to combat the devastating synthetic drug crisis, the deadly fentanyl overdoses, which has witnessed a continuous rise and now spreading to other countries in Europe, in addition to USA?
So I'll go first, and I try to be a bit shorter than what I had prepared for sake of time. I mean, so on one side, just to say that, I mean, we share the concern, right? We're seeing synthetic drugs emerging in areas where they have not been before, but I think our general concern is the overall lack of service capacity in most regions of the world, right? So UNODC, for example, estimates 1 in 11 people has any access to any services of drug treatment. And at WHO in the Global Status Report, we have estimated that at best, kind of 30% of people in need of services would have access to treatment of drug use disorders. So, I mean, I think in general, preparing health system responses to for offering services for people using drugs and people with drug use disorders, including harm reduction treatment, the continuum. I think that's, so to say, the homework we need to do, no matter also what drugs then will be emerging on the market and where we are massively falling behind, right? So, and this general guidance is available kind of in documents that I have mentioned over the course of the meeting, and to say that in the guidelines that we're updating on opioid use disorder treatment and opioid overdose, right? We will, to the extent that sufficient evidence is already available, of course, look also at the evidence around synthetic drugs and how maybe some of the recommendations need to be changed. Maybe with a view not so much to the synthetic opioids, but kind of other synthetic substances, just to say that yesterday, WHO also reaffirmed kind of its participation in the so-called Scale-Up Initiative, which is also reflected in a resolution here at the CND, and that is around more research for effective responses to stimulant use disorders, including, so to say, of course, amphetamines and so on, which also, as we can see in many parts of the world, are more and more playing a role of a different types of roles in overdoses that we see emerging, right? So, I mean, I think the message really is there's a lot and that needs to be done and can be done really, and overall to update the health system and health service responses we have to psychoactive drugs overall, and therefore to be much better prepared, so to say, also with a view to synthetic drugs entering the market. Thank you.
Thank you, Anya. I'm just going to jump in, and I'm happy to say that Anya and Dilkushi are able to stay a little bit longer today, but I'd like to invite you to join me in thanking Deus Mubangivi for joining us this morning, who has to run off to the plenary. But thank you very much for your answers today and for engaging with civil society. It's been wonderful to have you here in this dialogue.
Thank you so much.
Thank you.
Thank you. Thank you.
And I'll just hand over to Dilkushi to continue the answer for question 13. Thank you.
And I can say what Deus is heading off to relates to my response as well. WHO also convenes the Expert Committee on Drug Dependence and has been, since 2014, has been regularly convening the Expert Committee on an annual basis to respond to the kind of new synthetic drugs that have been on the market. And has reviewed on a scientific basis many NPS opioids and recommended them for international control to improve regulation and health responses to synthetic opioids. In recent years as well, the ECDD has been reviewing several nitazene compounds, and including at the session this morning, there will be several nitazene opioids that have been recommended by the Expert Committee for International Control, which are subject to a vote by the Commission.
Thank you. The next question is also for Dilkushi from the Veterans Action Council. Do we have Edian?
Given the growing body of international research supporting cannabis as a potential treatment for PTSD in war veterans, especially considering the alarming suicide rates, and for children suffering from severe epilepsy, what concrete steps is the WHO taking to encourage member states to prioritize and fund research on cannabinoid-based therapies?
Thank you for the question, and I think it relates a bit to the response I gave earlier regarding the 2019 or 2012 update of a guideline on access to balanced national policies to ensure safe medical access to controlled substances. So this is a guidance that will be again issued in May of this year, which will also offer kind of concrete guidance to policymakers to ensure that controlled substances are available not just for those that have their essential medicines on the WHO essential medicines list, but those that are being explored for medical and scientific purposes or being used at national level, and to ensure that again that there is a balance between access and safety. So there will be a set of recommendations, again, not specific to cannabis, but more general across controlled substances.
Thank you. The next question is also for Dilkushi from the Fields of Green for All NPC. Do we have, is it Amy?
Yeah, thanks.
Good morning. In May, the WHO will release its Traditional Medicine Strategy 2025 to 2034. To what extent and how do the different departments working with controlled drugs incorporate the specifics of traditional and indigenous medical practices in their work? Please comment on cannabis as an example of how these specifics are addressed.
Thank you for the question. So the WHO's Traditional Medicine Strategy from 2025 to 2034 aims to respect and preserve traditional and indigenous medical practices by integrating them into health systems, promoting evidence-based research, and ensuring quality and safety. The strategy is built upon several guiding principles, including evidence-informed decision-making, sustainability and One Health, rights and autonomy, Indigenous people's rights, culture and health, people-centered care and community engagement, integrated health services, and health equity. While the draft strategy provides a comprehensive framework for integrating traditional and indigenous medical practices, it does not explicitly mention specific medicinal plants or substances such as cannabis, but the emphasis on promoting evidence-based traditional medicines and ensuring the quality, safety, and effectiveness of these products suggests that medical plants like cannabis would also be subject to rigorous scientific research and also appropriate regulatory mechanisms. The approach would ensure that traditional remedies, including those derived from cannabis, meet established safety and efficacy standards before being integrated into mainstream healthcare systems.
Thank you. I understand the next question is coming to us online, but we might not have our colleagues online from Agora, Mexico. I might just ask the question 16 on their behalf. What would be the procedure to initiate a critical review about a psychoactive substance requested by a civil society organization?
So currently for the procedures of the WHO Expert Committee, we use a protocol called the Guidance on Review of WHO Review of Psychoactive Substances, which is also posted on our website, and it describes all the different phases of review that the expert committee goes through in its recommendation process, and also the ways to initiate a critical review. Currently, there are only kind of predefined mechanisms, and this has been endorsed by member states through the World Health Assembly and also the WHO Executive Board. And the current processes to initiate a critical review are limited either to an explicit request from the Commission on Narcotic Drugs, a formal request from a country, or an initiation from the Secretariat, whether if information has been brought to the attention of the WHO Secretariat, then a critical review could be initiated. So if a civil society organization does have information about a substance that they would like to initiate a critical review, we would encourage them to share the information directly with the Secretariat, who would review, and also if the information provided could relate back, again, the criteria that are considered by the WHO in the prioritization of substances is outlined in this guidance document online. So this would be the way to bring in information to the attention of the Secretariat regarding a request for consideration of a review of a substance.
Thank you very much. The final question we have today, I understand Anya might be able to answer on Annette's behalf. Do we have Christine Peer in the room from Soroptimus International? Yes, thank you.
Yes, good morning. Hello, everyone. Yes, my question is, how has the withdrawal of the United States and Argentina affected WHO's ongoing efforts in the area of drug policy, particularly with regard to gender-sensitive drug policies and support for marginalized communities? Thank you.
Yes, thank you so much for the question. I said also our colleague Annette is going to get back on that one, but just to say in general, right, so it's an open secret, of course, that WHO has kind of lost a good amount of funding, right, and mitigation strategies are in place, are being discussed under leadership of the Director General. And in principle, I mean, the Executive Board and the World Health Assembly are, so to say, giving us our overall guidance and work direction. So our mandates for now are the mandates they were before. And one of the things that I said, I mean, in terms of support for marginalized communities, one of the immediate actions we took with marginalized communities now directly affected by loss of funding for life-saving medications such as opioid agonist treatment I've mentioned a few times, right? So that we have shared initial guidance for comments and feedback as a background paper to a webinar which we had with a lot of stakeholders from government and civil society that have in the real world to approach this shortages of opioid agonist treatment and might have to respond to more overdoses in their communities and so on. So thank you. And we're doing fundraising. What can we do? Thank you.
Thank you very much, Anya and Dilkushi, for joining us today. And we've almost caught up the time. We're only running a couple of minutes over, but I'm so glad we were able to get through all of the questions submitted by our NGOs. If everyone would be able to join me in thanking Anya and Dilkushi for joining us this morning, we can follow up in writing with some of the questions that we weren't able to answer with colleagues from other parts of the WHO, but very grateful to have you here and to have this ongoing engagement and dialogue with the World Health Organization. Thank you very much for joining us.
Thank you so much. It was really interesting.